Hi. My name is Shannyn Caldwell. I am a radio host, a board-certified traditional naturopathic doctor, and the founder of The Healing Season. I am coming live today because our country now has got a case of COVID-19 or the coronavirus in each state in the Union. And our medical system is preparing. I would like to state right off the bat, I am not a medical doctor. None of this is medical advice. If you need medical advice, please call your doctor. Regardless of whether or not you have health insurance, call your doctor. Now here's what we know. Here's what I know. The doctors stand a very good chance of being overwhelmed, and so we need to be praying for them. I believe in the power of prayer, and so let's commit, okay, to praying and to trusting God through all of this, and to helping one another, okay? So, let's help our medical professionals deal with what they're going to need to deal with by not making ourselves some of the people that they need to deal with, okay? By taking good care of ourselves. What does that mean? Holistic wellness means that you take good overall care of yourself. I posted this question into the naturopathic board where I went to school, Genesis School of Natural Health. That's the top certification up there. Below it is my board certification from the American Association of Drugless Practitioners. Okay, so I posted into the board, guys, COVID, discuss. And I tossed out some of the things that I was thinking, and I waited for them to bounce ideas back to me, and now I'm going to share some of those ideas with you. First of all, overall wellness, same as it ever was. Don't watch too much news. Yes, stay informed, but don't obsess and don't worry. Fear, stress, and anxiety. What is the first thing that you start to feel in your body when you're feeling fearful? Probably, your jaw clenches maybe, but don't you feel short of breath right away? I feel like I can't breathe is what people will often say when they're stressed. And what we're talking about is respiratory. So let's not aggravate it with stress, okay? All right. Now here's what the World Health Organization is suggesting. They're calling it Do the 5, and these are the 5. If you're homeschooling, maybe you can memorize these today or write them down, and absolutely everybody do them all. Better safe than sorry. Number 1 is wash your hands. Number 2, and by the way, wash your hands. Number 1, all the time. Say it again and again. Wash your hands, soap and water. Take it as an opportunity to, some people are like singing a song, happy birthday, while you're washing your hands with that soap and water. Get under your nails. Don't forget your thumbs, okay? But you can take it as an opportunity to pray too. Like 20 seconds is what they're suggesting. That's about how long it takes to say the Lord's Prayer or the Serenity Prayer. God grant me the serenity to accept the things that I cannot change, the courage to change the things I can, and the wisdom to know the difference. I am not a scientist. I don't have a laboratory. If you are, bless you, go get them. What can I change? I can wash my hands. I can keep a safe distance, okay? I can put off my trip. All right, let's see. Number 2, cough into your elbow. No coughing into your hands. If you have to cough into your elbow, okay? Number 3 from them, don't touch your face. I swear I've probably already touched my face 20 times in this video. We all touch our faces, but this is a perfect time not to, because this is transferred through the mucous membranes, okay? So say, for example, I touch a package at the grocery store from someone who is carrying the virus who didn't wash their hands. I pick it up. I now have it on my fingertips, okay? If I don't wash my hands and then I touch my face, into my eyes, it can go into my nose, into my mouth, and now I can carry it to grandma. Okay? That's not what we want. So there's a lot of layers of things that we can do. And wash your hands is like, let's get clean hands and pure hearts, right? Okay, next, 6 feet. Stay 6 feet away from one another. World Health Organization is saying 3. United States is saying 6. Let's go 6. Let's go 10. Why not? Okay? And also, if you feel sick, stay home. Stay home. Okay? Let's see. What else do we know? We know that it's a lung disease and it's transmitted through mucus, okay? So what does that mean? Sneezing, coughing, this is how it transfers. No, it's not because you sneeze. It doesn't cause you to sneeze, but it is in your mucous membranes. So if you sneeze and you don't sneeze into your elbow, those water droplets can travel quite a distance, land on the grocery cart that I pick up and push around, okay? So we understand that, but we're all going to wipe. We're going to be monk about this thing, all right? What else do we know? We know that there's a lot of misinformation being circulated and that we don't truly know what the real deal is because it's called novel coronavirus. It's new, very new. So China was the first ones to discover this. It broke out, as I'm sure you've heard by now, from Wuhan, China, and then it's just been spreading and spreading, okay? What we don't know is almost everything, okay? Unfortunately. But thankfully, what we do know is really, really strong information. You know, these things that the World Health Organization is suggesting, we have seen, we have the benefit of having seen this travel across the globe before it ground zeroes here. Well, I mean, it's not ground zero is Wuhan, but you know what I'm saying. We've seen the global reaction and what has worked and what is not. So we have the opportunity to be successful. And I really implore you to take it. Let's be super ninjas about this. I'm getting downright, like, seriously, it's practically China at my door. Here, you want to know what? People are messaging me, Shannyn, what are you doing? Shannyn, what are you diffusing? Shannyn, what should I do? And this is actually one of the reasons why I'm making this live video right now. Because I want to help. I didn't go to naturopathic school to just put my books on the shelf, okay? So, let's see. I would say, as far as all that fake news out there, because we don't know what really is true. If the scientists and the medical doctors don't know what's really true, then you and I and what we're circulating on Facebook, we don't know either. But we do know certain things. We know how to take care of our lungs. Like, please, if you smoke, this is your moment. This is your time to quit, okay? Get that out of your life. You never needed that in the first place. So look at the blessings stacking up already, okay? Plus, you'll have some bonus money left over. So that's great. What is Asia reporting? That it was primarily affecting old people and people with underlying conditions. I can't imagine that it's suddenly going to change as it makes its way to the United States, okay? So, you know, people who are immune compromised and people who are elderly. Those are the people that we need to watch out for. So if you are not immune compromised or elderly, it's time for you to wear that invisible cape and be a superhero. And even though you don't want to hang out with, you know, you want to be right next to your buddies. I want to hug my friends. I want to have tea up super close and go, girl, spill it. But right now, we're going to leave some space, okay? We're going to leave 6 feet of space because the World Health Organization said, and because we love our old people and our people who are in weaker health. We're going to watch out for them, okay? I love what I'm hearing. People doing the grocery shopping for their elderly neighbors, leaving those packages on the porch rather than going in, which would be normal. I know it sounds extreme, but this is an extreme situation. So at our house, what does our personal protocol look like at the moment? When I go to the store, I'm wearing gloves, and then I'm washing them. What I am wearing on my outer coat. Okay, by the way, when I say when I'm going to the store, I'm not popping around doing the store thing like normal right now, okay? I went to the store yesterday because we were running out of very essential things. Milk, yeah, that kind of thing. By the way, milk, I'm talking about almond milk. Mucus, this is a mucus thing, and dairy definitely, we all know, causes mucus, right? So I love me some cream in my coffee, and I'm all about that grass-fed butter, but right now, if you start to have something going on in your lungs, get the dairy out, get it out, okay? That will help. All right, what else do we know? Let's see. I can't read my own writing. Maybe I should have gone to medical school. Okay. Here are some fake news and some things that the medical professionals toying around with, all right? You might be hearing something about colloidal silver, all right? There's strong research connecting colloidal silver to antivirals. Medical doctors who I personally know, including my medical doctor, is spraying colloidal silver in his mouth, okay? Research that. Don't hear me saying, here's medical advice, you'll cure yourself with colloidal silver. That's not what I'm saying. It's not what I'll ever say. I'm not a medical doctor. I'm not a scientist or researcher. I'm a traditional naturopathic doctor. I know a lot about herbs. I know a lot about helping the body find balance and ease, okay? It's the role of a doctor as a teacher, as a health practitioner. And here's what my traditional naturopath friends are saying. Sleep. Stay hydrated. Exercise, okay? In fact, I pulled out my big book, and if you have questions, you're welcome to pop them into the comments, and I'll do my best. I'm not kidding. I'm not playing around here. I'm researching for us, okay? And as I find important things to know, I will share them with you. I was looking in this book right here, Medical Herbalism. It was the hardest class I took in naturopathic college. Oy. But here's what it says at the very beginning of the respiratory system, all right? The respiratory system. Here's what it says. It says, preventative measures for the respiratory system are regular exercise and proper breathing. While breathing is often taken for granted, conscious and proper breathing is regarded in orthodox medical circles as invaluable. The central role of breathing in many spiritual practices should perhaps provide an additional clue. So, we will talk about a good breath protocol as we wrap this baby up, okay? And I know you guys don't have all the time in the world, and actually I don't either. I got to zip out to work in a minute or two. But I didn't want to let this day go by without sharing this information because I have it, and I thought, oh my, if you don't, you probably want it. You know what? It's my actual civic responsibility to bring it to you. So let's see, what else do we know here? You know what? There's some crazy, ridiculous thing going on the interwebs right now telling people that you should drink bleach. For the love of God and all things holy, do not drink bleach. Thank you for coming to my TED Talk. Let's see. What could you drink that might be helpful? Here are some herbs that you probably have in your cabinet right now for cooking that are also great for lung health, okay? Thyme, basil, and anise. Thyme, basil, and anise, okay? You know, same old thyme, just like you're going to get at the grocery store. So if you take those herbs and you infuse them, you can soak them like a tea for 15 minutes at least, okay? That is a good lung health support. Let's see, what else do we have here? I wanted to show this to you. If you've never seen one of these things, this is called a Himalayan salt inhaler. And what's inside of it is just, as you might guess, Himalayan salt, okay? And this is a breathing treatment. Same as you would like how your lungs feel so much healthier when you're near salt air. Okay, same principle. So you inhale. I'm going to show you how to use this, okay? You can, and all it is just salt air, okay? And you see there's little holes in the bottom here, and the air comes up through the salt. You inhale it into your lungs, and I'm going to show you, you know, a good, pure, clean, full healing breath on this, and then I'm going to show you how to do it with an essential oil, okay? All right, in the palms of your hands. This is also calming to your nervous system, which surely could use it. It's great for your lung health to calm your nervous system. Great for your overall health, okay? So here's this little guy. You just inhale and then exhale through your nose, okay? Now what I'm not going to do is exhale right back into it. It's just pressing, you know, bacteria, etc., right back into it. So you inhale, pull it away, okay? Pull it away, exhale. It's cleaning out this entire cavity. Salty air out. Salty air in, salty air out. All right? Now, let's talk about a deep breath. Okay? I'm not just breathing into the top of my lungs. I'm breathing all the way into my entire cavity. Front, back, down here. Okay? Now let's see. What else? What are you diffusing, Shannyn? For lung health, I am diffusing eucalyptus, which is also a known antiviral. Peppermint. Take a nice deep inhale of peppermint and go, oh wow, hello lungs. And tea tree, also, again, a known antiviral, antifungal, antibacterial agent. Lots and lots of research. Do the research if you wonder. Please do the research. I'm showing you, by the way, these are now oils. They're available any place. You can get them at, I live in the middle of nowhere, and I can get them at the Meijer near me. I can get them at the health food store. There's fancier oils. There's fancier herbs. But I'm trying to bring you things that I think that you can get and that you might already have, okay? And that can be helpful to you if somebody in your family starts to show these symptoms, which again, dry cough, high fever, and shortness of breath or chest pressure. That's when you need to contact your primary care physician, okay? If you are experiencing these symptoms and you've been told that you should self-isolate, then I would be busting out this eucalyptus and I would be rubbing it onto my feet because there are pressure points in the soles of your feet. That's reflexology. Go to my Pinterest board if you want to follow me on Pinterest. I have a traditional naturopathic medicine board. You can join the holistic wellness community if you want to talk more about these things or bounce ideas around. Join them at this Healing Season page. You can find me at thehealingseason.com. All right, what else? You can take those same oils, okay, those same oils that you have. This right here is just a little spray bottle. Inside of it, rubbing alcohol, purified water, and the oils that we just talked about, eucalyptus, peppermint, and tea tree. Now you've got a little spray that you can put onto your coat when you're walking around in public. Oh, I couldn't find any of that stuff at the store. Oh, now I've got it, okay? This is my yoga mat spray. I've been making my own yoga mat spray for, ever, but that's exactly what it's for. So there you go. You can make that too. If you want to make a hand sanitizer out of it, just instead of putting it into the water, put it into aloe vera gel, which again, you can get at the health food store or right in the same section of your local store where they're going to sell your essential oils. What else? Okay, this little guy right here is not how you're going to find it at the store. I just harvested this. This is echinacea root, okay? Google that, echinacea, E-C-H, okay? And lastly, this is something that you're not going to hear me talk about. Never have I ever recommended Tylenol. Tylenol, acetaminophen, can be really, really damaging to your liver and to your kidneys. And so I keep it out of my life for the most part. But again, we have the benefit right now of having watched this coronavirus move its way across the globe and see what people are doing and what is working and what is not. And what I can tell you for sure right now is that the military of Spain has a laboratory. And in that laboratory, typically what they do is make the military vaccines. You know, how the military is just constantly getting all the vaccines. Okay, well, guess what they're not right now. Guess what they're making? Hand sanitizer and acetaminophen. That should be an indication. It is an indication to me. The fever that comes along with this coronavirus is apparently different and doesn't break like a normal fever does. The normal treatments that people go to. However, what the global medical community seems to be sharing is that acetaminophen has been effective, or at least more effective. And therefore, for the first time in forever have I ever, I went to the store and bought some of this stuff. Better safe than sorry. So, speaking of better safe than sorry, just back to those things that we were talking about initially, those suggestions from the World Health Organization, you know, to wash our hands with obsessive regularity, far more than you think is necessary. I heard a medical doctor today suggest that we basically all just act as though we had this virus because we don't want to pass this. Okay, this shall pass, but we don't want to pass this. Okay, so now I wanted to share with you in conclusion, probably the most important bit, which is this part where we trust God. Okay, this part where we say, I don't understand, but when I am afraid, I will trust you, God. You know, God's not shocked. And he's not out of control. He is looking to us to be his hands and feet. We don't need to solve this. What we need to do is our part, which is to be calm. And, you know, I just wanted to share with you super fast. I'm looking at this psalm. It says, when I am afraid, I will trust in you, O God. When I am afraid, I will put my trust in God, whose word I praise. In God I trust. I am not afraid. You know what? This right here, this was my mom's rosary. And I pulled it out of the wreckage of the tornado that killed my mom and dad. And that is about the time that the healing season was starting to begin, because I knew that I would get sick if I didn't heal right now in real time. Because that's what stress does to the body, and grief and trauma. And this certainly classifies as stressful. This is a tornado that's hitting the globe right now. So we have the healing season starting now. Okay? All right, so let's practice trusting God. Practice breathing deeply. You want to talk about like this breathing prayer thing that they were talking about in my actual medical herbalism book? They're talking about the power of breathing and prayer for healing in the body. So here is a tool that you can use today. In review, tea tree oil, peppermint, eucalyptus, thyme, basil, anise. Those are things you have in your life right now, okay? Echinacea, All right. Obviously, elderberry. You know I'm your elderberry girl, but mostly take your vitamins. All right. Just stay healthy, stay strong, stay calm. Okay. And here's a tool that's going to help you with the staying calm part and your lungs part. It's called centering prayer. It is also called mantra meditation. We are going to practice it with Psalm 56. When I am afraid, I will trust in you, O God. Okay? Psalm 56, let's verse it. Why not? Chapter and verse. 56 verse 3. Psalm 56 verse 3. Okay? When I am afraid, I will trust in you, O God. Now, how does that work as a breath exercise or centering prayer? Here's how it goes. Inhale, when I am afraid. Exhale, I will trust in you, O God. Pause and let it sink in. Inhale, when I am afraid. Stop with those full lungs. And then exhale, I will trust in you, O God. Now, wanna level the game up? It doesn't have to be, these are just my mom's rosary beads, okay? But it could be any beads. You've seen people with those mala beads, you know, that long stretch of beads? That's for prayer too. Or you can just I've just taken a long rope and maybe stretched, you know, little knots along the rope or anything, really. Any pair of beads you have will work. It's just to keep you focused in the moment. So, inhale, when I am afraid. I will trust in you, O God. Next bead, inhale, when I am afraid. Exhale, I will trust in you, O God. Let's do one more together, shall we? When I am afraid. I will trust in you, O God. Thanks for spending time with me. Stay prayed up, hydrated, rested up, and may the peace of Jesus and his healing power be with you and yours. If you have any questions, just feel free to pop them down into the comments, and I will be happy to do what I can do as far as research. If you learn anything, share it with us. Thank you. God bless you.